I'm Sabiha Essack, South African National Research Chair in Antibiotic Resistance and One Health, a pharmacist by profession and professor in Pharmaceutical Sciences at the University of KwaZulu-Natal in Durban, South Africa. I am an expert consultant on antimicrobial resistance to the World Health Organization Africa Regional Office, the founder and co-chair of the South African chapter of the Alliance for the Prudent Use of Antibiotics, as well as a member of the South African chapter of the Global Antibiotic Resistance Partnership. There is a huge amount of disparity in these areas. Antibiotic use and subsequent resistance is influenced by characteristics of a country's healthcare system, the regulatory environment, economic incentives, and the interplay of the knowledge, expectations, and interactions of prescribers and patients, and this differs in different countries. Antibiotic resistance is being called the tragedy of commons, which requires collective international action by means of a multi-pronged, multi-stakeholder, multidisciplinary partnership between public and private sectors, governments and multinational pharmaceutical industry, non-profit organizations and civil society, as well as healthcare professionals, communities, and patients. These partnerships should be underpinned by unequivocal national, regional, and international policy frameworks that suspend sectoral interests for the public good. Respiratory tract infections are an important target for tackling AMR because the European Centre for Disease Prevention and Control states that primary care accounts for 80 to 90% of antibiotic prescriptions, and of this 80 to 90%, the vast majority are upper respiratory tract infections. They're the most common reason for GP visits at primary care level and account for between 57 and 90% of visits to GPs across the world, ranging from 60% in the UK to almost 94% in Thailand. Up to 90% of all URTIs are non-bacterial and most are self-limiting. Current research shows that most patients prefer to consult their physicians, specifically their general practitioners. As shown in our poster at the FIP conference, physicians were the most commonly contacted healthcare professional for upper respiratory tract infections, followed by pharmacists and pharmacy assistants. This varied widely by country. For example, physician consultations ranged from 22% in the UK to 64% in India. Patients often consulted physicians for reassurance and symptomatic relief as opposed to requesting an antibiotic prescription, which is where there is a role for pharmacy. Pharmacists are able to assess patients and identify red flags and ensure that patients who do not need to consult a physician are treated appropriately with symptomatic relief rather than with antibiotics. The annual International Pharmacy Federation meeting is a pharmacy-focused meeting attended by thousands of delegates each year. It was held over 4 days in Düsseldorf, Germany this year with the theme of Better Practice, Science-Based, Evidence-Driven. The conference is a chance for the international pharmacy sector to network, learn, share, and exchange views on best practices in pharmacy.